Hi, everyone. My name is Sadaf Hassan. I'm a writer, editor, and producer based in Toronto, and I'm your moderator for today's panel. It is my pleasure to welcome you to today's talk, Experiences of Dementia in South Asian Communities in Canada. Now, more than 600,000 people in Canada are living with dementia. That means that every day, more than 350 people in Canada develop dementia. That's more than 15 every hour. In 2021, South Asian people represented 7.1% of the country's total population, or 2.6 million people. That's the largest visible minority population group in Canada, just to put into perspective. And some recent studies from the UK suggest certain types of dementia risk in those countries can be higher in South Asian people compared to white people, and that Asian people may develop dementia at younger ages. Yet, despite this, relatively little research has been published to date on how dementia impacts South Asian people in Canada. One of our speakers here today is one of the few working on that very topic, actually. We'll meet her soon. As we're here today to try and share knowledge about and expand awareness and advocacy around this very issue. Now, before I jump into welcoming our great panelists, I'd just like to go over a few housekeeping items. This talk is presented by the Alzheimer's Society of Canada in partnership with Brain Canada. You can find out more about both of those organizations in the chat. The session is being offered in English with live interpretation in Hindi, Punjabi, and French. To select a language, you can click on the interpretation button at the bottom of your screen and then choose the appropriate language for you. You will also notice that poll questions would occasionally pop up on your screen throughout the session. This just helps us understand if we're meeting your needs, so please do provide your feedback. The session is also being recorded and will be made available on YouTube and alzheimer.ca in the days to come, so look out for that. Lastly, this is a conversation. This chat is open and it's being moderated. In case you want to say hi or share any experiences or resources, please do. If you have questions for our panel, send them through the Q&A feature on your Zoom. There we go. We got one right now. We will do our best to get them answered near the end of our hour together, and any that aren't answered live will be followed up via email in the days to come. So if you do have interest in that, please provide your name with your question if you want that email follow-up. Now, I am coming to you today from land that is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. I also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. The Alzheimer's Society of Canada encourages you to learn more about Indigenous-led and co-led initiatives in dementia, including but not limited to the Native Women's Association of Canada's Dementia Toolkit, Anishinaabe Dementia Care, the Canadian Indigenous Cognitive Assessment and Dementia Resources from the National Collaborating Centre for Indigenous Health, just to name a few. The websites of these organizations are now in our Zoom chat for you to use, to share, to support, and to learn from. And now it's my pleasure to introduce the incredible panelists who are joining our conversation today, all of whom provide very important perspective on today's subject. First, let me welcome Navneet Dhillon, Director of Health Services at Indus Community Services, which offers specialized care for clients with dementia-related illnesses, among other services. Next, we have Navjot Gill, Ph.D. candidate at University of Waterloo, whose research explores experiences of South Asian Canadians living with dementia and their care partners. We've also got Sandeep Lachhar, Project Manager of Health Projects at Indus Community Services as well, which offers specialized care for clients with dementia-related illnesses, among other services, again. And last, but certainly not least, we've got Bhavani Patel, caregiver and advocate, who is on the CEO's advisory group at Ontario Caregiver Organization, and who also participates in other groups. Thank you to all of you for joining us. And now it's my pleasure to begin our group discussion. I'm going to kick off our first question. What do you all think more people should know about experiences of dementia in South Asian communities in Canada? I'm going to start with you, Navneet.
Hi, everyone. We're really excited for this opportunity to be here to share more information. So firstly, I want to start off by saying South Asian communities often face additional challenges Due to cultural, linguistical, and generational differences, increased awareness can really help in providing culturally sensitive care, support, and resources to these groups, which can improve the quality of life for those affected by dementia in these communities. It's important to note, though, that there are a lot of different South Asian communities in Canada, which are each diverse in their own ways. There's subgroups such as Indian, Pakistani, and a lot more, and each of these groups has its own cultural practices and beliefs. So I think it's really important for healthcare providers to be aware of that, and community organizations when assisting those living with dementia. And also just understanding that South Asian cultures have strong family ties and community ties, which can influence how dementia is perceived and managed. Understanding these cultural nuances is essential for healthcare providers and support networks to provide the appropriate care. For example, the stigma associated with mental health can be significant in some South Asian communities, which can delay diagnosis and treatment for those living with dementia, because some of the behaviors that a loved one might be exhibiting are just seen as the normal signs of aging, which is leaving an individual in a spot where they're not really getting the care that they need until perhaps there's been several critical incidents, and then also leaving caregivers in a spot where they're not receiving support because they're actually not realizing that no, in fact, this is not a normal part of aging, and that they do actually require some additional supports.
Sandeep, I'd love for you to add on to that as well.
Yeah, so there is a significant stigma associated around dementia in the South Asian community, and that is due to the lack of awareness and misconceptions. So South Asian cultural beliefs and traditions may influence the perception of dementia. And as Navneet stated, it's considered a normal part of aging, and this can hinder families seeking support and medical care and resources. Concerns about family honor and reputation can lead to reluctance in acknowledging dementia, which can within the family and result to delay in accessing supports and services. And this is something we've seen at the Adult Day program. So caregivers will seek Adult Day program services at Indus when they're at the later stage of dementia or at the point where the client needs multiple services. And so we believe the delay in accessing services is a result of missed opportunities, such as access to early intervention, education, and resources. And as healthcare providers and families, we need to open the discussion to promote early intervention and supports. And it starts with understanding the South Asia's unique experiences with dementia itself. And the dementia funding we received by Public Health Agency of Canada, Indus is trying to get there to help break down these barriers, promote activities and resources, and help raise awareness and encourage people to seek diagnosis and supports.
And Navjot, would you like to add?
Yes, thank you so much, everyone, for joining us today. And I'm just going to build up on what Navneet and Sandeep said. So when the most important thing is, of course, looking at the lack of awareness of what dementia is and the stigma. And how I like to put it is it's a vicious cycle. Because there's lack of awareness, it leads to stigma. And because we have so much stigma around dementia, it leads to lack of awareness. But one of the major things is there is no term in most of the South Asian languages for dementia. It's loosely translated to memory loss. In extreme cases can be seen as madness. And of course, that's where it's potentially sometimes seen as a mental health issue. And due to the stigma associated with mental health issue, people are very reluctant to talk about it. In terms of stigma, the sociocultural norms play a really big part. Research has shown, and again, most of this research is out of the United Kingdom. For example, sometimes the symptoms of dementia are seen as karma, where people normalize it as, they're paying for the sins of their past life or something they did in this life. Or it's even sometimes seen as, when the behavioral symptoms or the personal expressions come in, it's seen as, they're developing a deeper connection with God. So that's fine. In some Bangladeshi culture, because dementia is seen as a suffering, they believe that it should not be looked at it as a negative, almost because if you're suffering in this life, you're going to attain heaven once you pass. So these are some of the ways dementia is really normalized and the stigma that comes with it. Also, the piece is, since it's often stated as a memory loss, you have memory loss. And if someone is aging, it's very easy for us within the community to say, oh, you know what, they're getting old, that's fine. They're supposed, don't you forget stuff, like they're 60 plus, 70 plus, that's okay. So when the cognitive symptoms are in, with the memory loss, families are often able to keep up. but it's when the behavioral symptoms and the personal expressions come in, they're like, oh, what is going on? Like, what is this? And that's when things kind of steamroll and crises come in. And that's the stage where, Sandeep, correct me if I'm wrong, is when patients, families, sorry, and people living with dementia are actually showing up to services when it's already progressed to a stage where, you know, daycare programs may not be the suitable option. They should have come in earlier, but since there was such lack of awareness, they weren't able to recognize those symptoms and seek services in the earlier stages to make that journey more comfortable.
Fascinating. And Bhavani, turning to you.
Yeah, thank you for having a caregiver perspective. And everything that everyone has said really resonates with me from a caregiver perspective and having someone with dementia at home, because those signs can show up in not just a forgetfulness manner. So dementia, Alzheimer's is not just about their being forgetful. And we need to open that discussion within our homes, within our communities, within our places of worship, just to keep having those conversations, that it can show up for people in various different ways. Lack of motivation. It could be an unwillingness to participate in activities that they once used to participate in. It could be the loss of daily functions, self-expression, loss of motor skills. So taking away that stigma about, oh, they're just being forgetful, they're just aging, they're just getting old, and everything that Navjot just said as well, that plays into the cultural side of it. So I think it's important that more people in Canada know that it's okay to talk about it in the South Asian community, and that we should be talking about dementia, Alzheimer's, and cognitive decline, and then also to get your person tested as well, and then seek the support solutions, but then access them and participate in them. And I think that all encompassing is really important for people to know.
I'm curious from all of you, based on what you just shared, which is excellent, but what do those culturally appropriate resources look like that we can provide the community? I'll turn to you first this time, Navjot.
Yes, so in terms of resources, I think one of the main points we need to understand is that translation does not equal adaptation. So we just can't translate resources and put them out to the community and say, here you go. They need to be culturally appropriate. There are terms that could be stigmatizing, you know, reading the first line, the person could be like, you know what, I cannot relate to this. I'm not going through this, that. And then of course, the representation of the community within these resources. So not having videos where, you know, there are couples of European descent or families and, you know, you're doing a voiceover and expect the community to be okay with it. There should be a representation in terms of, you know, they're looking at the video and they're like, oh, that person, you know, looks like me, speaks like me, and I can relate to them. And, you know, this is normal. So this is happening within my community as well, because one of the biggest beliefs I feel within the community is also along the lines that dementia is not something that happens back home. It's a very Western disease. It doesn't happen to our people. And again, this comes from the lack of representation. So the focus of the resources should be on addressing that stigma, addressing that lack of awareness, layered with the representation and culturally appropriate resources. So just translating the definition of dementia and symptoms is potentially not going to cut it, because that doesn't lead them to understanding other things, such as, you know, sundowning, wandering, or other personal expressions. Sheridan College has been doing some amazing work on this. They have created a toolkit where they're putting up scenarios of, you know, if your loved one is behaving in a certain manner, this is what you do. And it's culturally appropriate, right? So the conversations that we have, like Navneet highlighted at the very beginning, the family ties and the honor and how we interact with our elders is very rooted in a cultural aspect. So that really needs to be addressed within these resources.
Absolutely. And Navneet, I'll turn to you.
Yeah, no, definitely agreeing with everything Navjot said. I think in addition to that, we really need to look at our public awareness campaigns, I think in general, and what channels we are using to push the information out. I know Indus has had a ton of success with reaching out to ethnic radio, ethnic TV channels, because these are the stations that, you know, caregivers are listening to. This is where they're getting their news from. So having experts come on those different channels and then actually sharing the information in Hindi, Punjabi, a variety of other different languages that just goes beyond, a piece of paper that's translated. Having someone come on and speak about their own experiences with a loved one who has had dementia and how they were able to get support. I think it's really important that we, continue to invest in these type of campaigns and then push the information out.
Absolutely. And Sandeep?
Just kind of going off what Navjot said, it's just that representation piece of South Asian knowledge experts to share dementia information is needed. And something with the Dementia Project that we've come across is, finding these knowledge experts to present the information to the community. We often find ourselves translating, or we're using our staff to, share that information. We want people to speak the language and connect with them, and more of the caregivers and the clients sharing their stories. And something that I came across was the Alzheimer's Society in UK had one of the older women of South Asian descent, speak about her story. And I thought that was so touching, because she spoke about when she first, started seeing symptoms, going through the diagnosis process, going through the shame that she would feel, going to her women's group and realizing she actually had a strong support system when she started connecting with her family and friends. So more of that representation piece is needed.
That's a great point. And finally, Bhavani.
Yeah, I agree with what these ladies have said. And I think from a caregiver perspective is also finding the support system with the non-South Asian communities, because a lot of the personal support workers, the nurses, the doctors, everybody that a caregiver encounters with the dementia patient is predominantly non-South Asian. So we as caregivers act as translators, interpreters, putting things in context and cultural context. And so it's educating everyone else in the healthcare system, the support system, just as much as the South Asian community as well.
Absolutely. And I'd like to ask each of you, what is something that has surprised you lately as you continue to learn more about this topic? I'll come to you first this time, Bhavani.
Yeah, I think going back to the support system, so one of the things that surprised me was to look at the support services and the healthcare system in a different light, to sort of question, what do support systems of the future look like? My dad was just one person with dementia in the South Asian community that I knew of. I didn't know anyone else who was in this situation. But as you start having these conversations with Lynn, CCAC, with doctors, pharmacists, everyone in that sort of care network, you realize that there are more people in the South Asian community with dementia. They're just not linking and bonded together to have the same conversation. So when caregivers are supported by personal support workers and nurses and doctors that aren't of South Asian background, how do we then build a network where they can understand the South Asian community needs from a linguistic point of view, from a spiritual point of view? But then how do we, again, build up the support services of the future, and sort of how the sector in healthcare and the social community can be elevated to support a variety of languages that are spoken across Canada, and support the spiritual needs as well, which is very important for the aging population.
Absolutely. And Navneet, anything to add?
I think for me, even since, it's been 3 years since the onset of the pandemic, but just looking at the advancements that have been made in terms of virtual supports available for persons living with dementia, they're not always able to, get to a program. Some individuals do, a lot require that support at home. Their caregivers require support. So it's been, nice to see that there's been developments in the type of virtual programming offered at home. At Indus, we do have a variety of virtual programs that we were able to offer where that can help with memory, arts and crafts activities, music activities, that just can be really therapeutic for persons living with dementia within their home, as well as for resources for caregivers as well. I'm actually going to pass it over to Sandy to share more about the activity kits that we have been able to create to support individuals living with dementia.
So during the pandemic and with the dementia funding that we received, you developed dementia activity kits for people living with dementia so they can do at home and just bring more awareness about resources and tools that are available. In the process of putting together these kits, we came to learn, and also it was not much of a surprise, that there's not a lot of South Asian activities and resources that are available. A lot of these kits started looking more westernized and didn't represent the community, we're trying to reach. And when we were providing these kits to the families or older caregivers, they didn't know what to do with them or what environment to conduct them in. What words do you use to engage this person into doing an activity? And the most easiest thing is turning on the TV or just letting them sit down. So they're so isolated. And that's what we didn't want to do. So we created these kits and we tailored them to each individual, plus including instructions and informing the caregiver how to do them with the diagnosis that they did have. And we got overwhelming response from the caregivers, that it helped, that they always just watch TV or they were in their room listening to music. It was something different that they got to do and participate. So part of our program at Indus is to increase the awareness of activities and using household activities that they used to do, laundry, going for a walk, playing Ludo, reminiscing activities, gardening, just using things that are around the house to engage that person in.
That's great. I love Ludo. That's a great example. Navjot, what would you like to add?
Yes, I would like to address the research side of things. I feel all of you have beautifully covered the resources side of thing and how there's such lack of resources when it comes to those resources being culturally appropriate. But even on the research side of things, I remember when I first started looking at research on Canadians living with dementia and their care partners, and the first time I conducted that literature search, there were maybe about like 10 studies, 10 to 13, and more than half of them were Indigenous, just because I had the term Indian as part of my search term. And I automatically thought that, oh, I'm doing something wrong. Like, is this possible? Because very rarely have I ever searched for something and PubMed has, or like the complete structure has not shown me thousands of search. So I sat down with the library and we did the search again. And it was the same. And I was shocked that, why is there not the research that's needed to understand the experiences? Because if we don't understand what they need, how are we supposed to provide those services and resources to them? There is a lot of research, like I said before, out of the UK and even the USA. There are books that have been compiled. Again, just disclaimer that these books are for like all of the ethno-racial communities, is not just South Asian, but there is good amount of South Asian research. But again, we cannot generalize that to the Canadian population, just because even though our healthcare systems may be similar, but the migration patterns, the immigration history, the racism experience, and all those other things are very different in terms of the communities that settled in the UK versus the America versus Canada. And also there's this thing, a third culture that we kind of create when we immigrate to a different country. And it's kind of like a mixture of the host country and what we bring back from home. So that is very different across the three regions to say. So it wouldn't be similar between UK, US, and Canada. That's why we do need that research coming out of Canada, understanding the experiences of people living with dementia and their care partners from within Canada to really understand how we can better support them.
Absolutely. And I'm curious too, if you can all share a little bit on what you think governments and others need to do about experiences of dementia in our community in Canada, and how we can help reduce the stigma, especially. I will turn to you first, Navneet.
Definitely, what Bhavani said really stuck with me, and I think that there needs to be a bigger investment in cultural competency training overall, and providing cultural competency training to healthcare professionals to increase their understanding of the diverse cultural backgrounds of people living with dementia and their families as well. It needs to cover cultural beliefs, traditions, languages to ensure better communication and care across the board. Because we're just not getting that. We are spending the time. I know that I've done it myself with my mom, being a caregiver for her, just doing the translation back and forth, explaining to them those different cultural pieces that they're able to not get. And it is due to lack of, lack of not having that training, no fault of their own. I think that we also need to do a better job at community engagement, engaging with cultural and community organizations to develop culturally tailored programs and support networks for individuals living with dementia and their families, because these organizations can play a vital role in helping reduce the stigma and providing that culturally sensitive care. I know I've already touched on public awareness campaigns, but just, a bigger push to get those campaigns launched nationwide. We were lucky enough to get funding to be able to have culturally appropriate dementia care awareness campaign. But unfortunately, these are based on funding contracts that will go maybe for a year or 2 years. And we need it to be a lot longer than that and more permanent. And just finally, I know Navjot did talk about this, but just really more of an investment in research and data collection, invest in research that focuses on dementia within specific cultural groups, collect data on the prevalence, the risk factors, and access to care to better understand the unique needs of different communities, but then also spend time to assess the effectiveness of the programs that have been developed and how can we improve them to make them better.
And Sandeep, if you'd like to add.
Just bits and pieces of what everyone's saying. I think it's developing more dementia care services and more adult aid programs that represent the South Asian cultural practices, their dietary needs, religious considerations, and how South Asian elders want to be treated is also very important to make sure we retain them in the adult aid program. And this can be done by creating policies around culturally tailored services, providing, how Navneet said, culturally tailored competency training to healthcare professionals to better understand the cultural values. Understanding the cultural heritage of individuals living with dementia, enables high quality, safe, person-centered care. And again, ensuring that they stay in adult aid program for as long as they can, and long as adult aid program can support them, and then going on. What we do need is like a continue of services, aging services. If they're not suitable for adult aid program, what are they suitable for? Is there programs that, let's say adult aid, where they can get together, and if they're not suitable for adult aid and they don't want to go into long-term care, what other home aging services are available? South Asian cultures want to age at home. They want to keep their loved ones at home. What services more can we provide, and how can that government tailor to the needs of our community?
That's an excellent point. And Bhavati, if you'd like to add.
Yeah, just on the aging at home subject, that is very relevant to our culture. And just recently, I think it was last week, CMHC, Canada Mortgage and Housing Corporation, had a report that the seniors in the country are actually not selling their homes as frequently and quickly as they once used to, because they want to age at home. And that wasn't even just about a nationality, that was just seniors aging at home in general. So when you drill it down to the South Asian community, they are more likely to stay at home versus going into a long-term care facility. So having said that, what do governments and healthcare organizations need to know is that aging at home is becoming more and more of a conversation and a preferred method of aging for seniors. So funding for aging at home support services versus just funding the long-term care land and building and projects is going to be and should be a focus. We hear continuously about long-term care facilities opening, but there aren't any that are South Asian specific, or the funding goes into the long-term care projects itself and not into the aging at home services. So the home care services, whether that's CCAC or LIN in general. Having said that, going along with support care services is the talent pool pipeline. Being a caregiver for someone with cognitive decline, the services that you need ramp up or need to ramp up as somebody's cognitive decline goes down, as they continue to decline. But we have, and we are all aware of it on different levels, that there is a resource shortage. And so how do we build that up in not just in each province, and not just specifically for South Asian community, but for the entire nation. So I think it's about really thinking about what the talent pool looks like, engaging colleges, universities, learning institutions, mentoring, and that kind of a thing. And lastly, I'll say that volunteers are also just as important to be a part of helping to look after someone, especially in the South Asian community, when you have a one-to-one volunteer program, or you have somebody that gives companionship. Those type of supports can really go a long way. So the organizations that provide those volunteer assisted programs, funding towards their initiatives as well, I think is really important.
That's such a great point. I'm glad you mentioned that, Bhavani. And Navjot.
Yes, again, building on what everybody said and bringing in that research perspective as well. Even from the research side of things, we need to make research more inclusive and accessible. So researchers need to be trained to conduct research with ethno-racial communities in a safe and inclusive manner. The UW Schlegel Research Institute of Aging is currently in the process of making a resource for researchers on how to do that kind of research, where you're engaging with ethno-racial communities. So, having that research where, offering the research in English and expecting people from different communities to come participate is of course going to cut them off right off the bat, right? You need to have research participation available in other languages, so it's more open to the community. Being mindful of how you're presenting that research. A very small example is in my research when I'm doing the demographic survey. Usually we ask participants about their sex and their gender identity. I'm leaving out the gender identity piece with the understanding that, within the South Asian community, we're not open to talking about gender identity. It's just what we're assigned at birth. But if I left that in, it could have potentially led to people just saying, oh, what is she asking? If she's asking me this right at the beginning, what is she going to talk about later? And, that uncomfortableness and that stigma is going to kick in and they might not even participate. So making sure that the research that you're developing with the community is appropriate and it's co-designed. So, from the very beginning, you're involving the community. So it's with the people, not on the people. You're not just going in and doing the research and backing out. They should be walking with you side by side when you're conducting that research to ensure that it's safe and we're not doing more harm than good. And even from the healthcare perspective, the cultural humility piece, having that internal your own reflection of what are your privileges, your biases, the assumptions you have about a certain community, checking those in and having that open-mindedness of lifelong learning that I may not know everything about every community, but as long as I'm open to learning, it's going to be easier journey for both me and the person I'm interacting with.
Absolutely. And something that you just touched on, Navjot, and all of you actually have touched on, is access. And I know there's a lot of South Asians in this country who do not have access to really many resources at all. And I'm curious if you can touch on what those folks can do and what those communities can do and how they might be able to find what they need to help them. If I can start with you, Bhavani.
Yeah, I think in terms of access, is for the South Asian Network to access their network. And they are very connected, whether it's on a spiritual level or whether it's women's groups or seniors groups or just community groups based on the sort of subdivisions of South Asian communities. There is a network where someone can phone somebody, an auntie can phone another auntie and get some information. And I think just drilling it down to something as basic as that, as phone a friend and start there to access resources, investigate resources, and find out what's available. The other place that I think is really important that we probably don't utilize enough are all of the places of faith where people go to worship. And a lot of that pivoted to online during COVID, which still does exist as well. And I think if we had community leaders and faith organizations to start having these conversations and promoting resources and promoting the conversation about cognitive decline, I think that would help as well because they're seen as trusted.
Certainly. And Navjot?
Yes, for sure. I think it's also enabling and empowering people with lived experience to speak up. So providing them with spaces, for example, this right here, hopefully next year, maybe we'll have more care partners and even people living with dementia who are willing to share their experiences. And, supporting them in the sense that it's okay to speak up. So that's with the spaces that they should have, right? It's very difficult for them to come into spaces that are very white, and they may not be able to relate to those to come and speak up. But if the spaces are culturally appropriate, safe, they might be more open to sharing their experiences where they know that the cultural nuances and the other societal aspects are more better understood. So yeah, in a nutshell, just empowering people with lived experiences to come forth.
Absolutely. And Navneet.
Just building on what everyone said, especially in terms of connecting with the places of worship. I know we have had a great amount of success with partnering with local gurdwaras and having community health ambassadors be on site at the gurdwaras, working with faith leaders to talk about these important topics and then redirect them over to whether that's our website or our phone number where someone can call in. And we'll be able to assist them and provide information in whatever language that they do speak. We've seen a ton of success with that. So we are looking to continue to do that and connect with other religious groups as well. And then just our own Indus Day program and pushing that information. Sometimes it does still shock me till this day that people don't know that these supports are available for their loved ones, for their grandparents, even, speaking with my own friends and sharing with them that, these supports are available not only for their grandparent, for their parent as well, who is the caregiver. And we do have, our monthly caregiver support groups, which are both held virtually and in person, where we recognize the caregiver does need that support. So we try to do those in a way that are a session that, is promote self-care for them. We've had a variety of sessions where we're doing, art therapy, Zumba, or just a safe space for them to talk to one another and share their stories and know that, hey, I'm not in this alone. There's someone else, who looks like me, who speaks the same language, who is actually going through this same thing that I just thought was a normal part of aging.
And Sandeep.
Oh, geez, what is left to say? But just kind of going off by what everyone's saying is we create all these tools and learning guides. And I know, I think it's more collaboration within organizations to share this stuff amongst what we've created with one another. So then we can then share it with other organizations and our community partners and our clients. That's the only way to get access started is when they come to us and they say, I need help with so-and-so, I have these resources ready for you. Here, why don't you go through this with me? Let's do this together. It's just, but we need more collaboration to have these, to have access to resources.
Finally, I know a couple of you have had some personal experiences with family members who've lived with dementia. I'm curious if there's anything you've learned from those experiences that you might want to share.
I would just like to echo Navneet and Sandeep's point. So my grandmother is living with dementia, and I was not aware of Indus until very recently. And so that just goes to show that I am doing research within the dementia sphere. And I looked at different resources, and it's always the lack of culturally appropriate resources that kind of shock me, because the services and resources that are out there are amazing. I had the opportunity of working with Alzheimer's Society, a local chapter in Ontario, where we used to do day programs, and they're so amazing. You get socially cognitively engaged, physically engaged with their minds in motion. But then I reflect on my grandmother being at home and how she doesn't speak the language. She doesn't understand what Zumba is, or what line dancing is, or what bingo is. So how do I expect her to go into these services and participate in them? So that just kind of brings back to having those services, and not just having them in place, but also taking a step back and increasing that awareness about dementia, because we can develop all the resources, we can develop all the programs, but if we show up to a South Asian's house and say, hey, come on, we're going to do knitting today, or we're going to go play Ludo, bring your loved one who's living with dementia, they'll be like, sorry, nobody here is living with dementia, just because the stigma and the lack of awareness is such. So we need to start from the root cause, address the stigma and the lack of awareness with appropriate resources, and then build up from there to resources such as day programs and other community support programs, and even support programs for care partners. Because along the lines, we often tend to forget that, especially within the South Asian community, especially among the women of the South Asian community, it's very normal for them to just take on care partner duties without realizing that there's burnout down the road if they keep on with their full-time job and their full-time care partner and not ask for outside help. So that's very important piece as well, is empowering care partners with the appropriate resources as well.
Thanks for that, Navjot, for opening up. And we're at the end of our panel here. Before we head into the Q&A, I just want to ask all of you, we've covered quite the gamut of questions, but is there anything any of you wanted to touch on that maybe we didn't get to at all?
If I can just touch on the caregivers side of it, in Ontario specifically, as per Ontario Caregiver Organization, there are about 4 million caregivers in Ontario for a variety of reasons, and about just under 8 million across Canada. Obviously, this number is expected to grow, and that's just Ontario. If you break down and look at some of the stats, there's about 350,000 caregivers for just dementia-related illnesses, and that was about 2020. Going into 2050, the prediction is that that number is going to rise to about 1 million. So there is attention and support needed for the caregivers within a South Asian community who tend to be the translator, interpreter, and the doer of almost everything when it comes to caring for someone with dementia, Alzheimer's, or a cognitive decline. So I think it's really important that from a data collection perspective, that we do respond to the census questionnaires that come around, because they do set up the information of religion, language, geography, and that also can help to build up the support services in necessary areas for the necessary languages. So I think coming back to data collection on the caregiver side of it is also really important. And secondly, there aren't a lot of financial supports for caregivers. So where you can help a caregiver by what Indus does, for example, is really important and really valuable. I'll say lastly that my parents are participants of Indus's programs, and I learned about Indus because somebody at Alzheimer's Peel told us about them. We never knew they existed either. So, and that was probably about 7-8 years ago. I do commend Indus for what you guys do, and we just happen to be on this panel together without even knowing that. So I think it's really important to support the organizations that help the caregivers, but also support the patient at the end of the day.
Thank you so much for that note, Bhavani. We're so glad to have all of you here. Thank you for this incredible conversation. I learned a lot. I'm sure a lot of our participants did. And speaking of which, now we're going to head into the question and answer period. I'm going to choose a question from the Q&A box. We've got a few here, which is great to see. And just a reminder that if you ask a question and we aren't able to get to it live, the Dementia Talks Canada team will follow up with you in an email. So if you do want that, please do make sure that you add your name with your question, and yeah, you'll get an email. All right, so the first question we've got is from Cheryl Miller, and she is asking, is there a South Asian network in PL region, GTA, that addresses health or issues related to aging? She's interested in connecting and bringing a few more services to South Asian care partners. If any of you would like to tackle that.
In regards to aging services, I know what we do at Indus, we do have the Apna Health website, which talks more about South Asian diabetes, cancer, and chronic illnesses. At Indus, we do have caregiver support groups, as Navneet stated, just to learn about illnesses or chronic illnesses that are happening in the community, but not anything specific. I'm not sure if Avni Ontario organization does anything.
Ontario Caregiver Organization wouldn't have anything that's a South Asian specific caregiver network. But I think there's probably room to expand here outside of just the Peel region area. So I don't know if there's a way to connect with Cheryl after this to have a bit more of a discussion, but I think there might be an opportunity here.
Certainly, and Cheryl, you've just been connected in the chat with the Upna Health URL as well, so kind of listing it to that. For another question from Naseem Sinderji, he asks, have they figured out why South Asians don't tend to score well when tested? I assume that comes to diagnostics, but if anybody would like to tackle that.
I can touch upon it just based on what I've read in the literature in terms of the tools that are used for cognitive assessment. Again, I cannot speak to the appraisal of these papers. I haven't really gone into details with them just because it's not really part of my current project, but I have seen them online in terms of some of the research states that these the assessment scores that we use are usually translated and again, not adapted. So because it doesn't capture those cultural nuances, often people score less or not on the right spectrum. And this also sometimes leads to misdiagnosis. So yeah, that's one piece of those tools not being culturally relevant. Could be one of the causes for that. Again, there's research out there that I haven't really explored yet, but I do know that is one of the pieces that's there.
And if I can just add to that from a caregiver side of it, for my dad who did go through the testing, and every 6 months they continually go for testing to see where they're at and what stage they're at. Those tests are all done in English. So if presuming that within the South Asian community, English is either your last language that you learned, which is going to be the first one out, the testing may not be comprehensible. So where caregivers come in is playing the full interpretation translator role. So every test that my dad did, for example, I have translated it so that he responds to that answer as he was declining in Gujarati, which is our primary language.
And just to add to that piece as well, what Bhavani is saying is that, you know, when we as children are translating for our parents, they might not want to answer honestly and downplay, you know, how they are feeling just because of the embarrassment and shame. So, you know, again, going back to the representation, the translation is needed for these services to have accurate and better scoring can help as well.
And also understanding that a lot is lost in translation.
Yeah.
Even when we're like back translating, and you know, we often end up, like I remember like with my parents, I often ended up paraphrasing what they're saying. So bits and pieces which are important for the physicians or the healthcare providers to pick up, they get lost. And of course, the social desirability piece where, you know, just answering to kind of align with what you expect the physician wants to hear is another piece, especially with such tests where it's more so objective than subjective. Yeah.
Wonderful.
I just wanted to quickly add to this, just because we're talking about assessment, just to share that often even getting to the assessment is that's a win in itself, because most don't even know that such an assessment exists, or that, you know, there's a different type of doctor that you need to go speak with to, you know, there's a geriatric doctor, or there's someone that you can go connect with to get this started. So I think that's just a really important note to make.
Absolutely. Well, thank you all. We have another question from Mario Gregorio, who lives with dementia himself and is also a dementia advocate. But he notes that, you know, one of the things when it comes to cultural barriers with dementia is that there can be this understanding that suffering is acceptable if it means, you know, you then obtain a reward by going into the afterlife. And that's kind of a common understanding in some cultures. So he asks, what initiatives can be done to transcend that particular barrier when it comes to care?
I think it's important to understand that it's part of culture. So it would be wrong to go in and say, oh, what you understand about dementia is wrong, just because you have a cultural lens to it. So that's, I feel, where the cultural humility piece comes in, is understanding how that culture and societal norms is playing into how they understand dementia, and working towards respecting their cultural norms and respecting their background, but at the same time, raising awareness of, not saying that you're wrong, but this is what dementia is, and really highlighting the symptoms and the behavior and the cognitive pieces that comes with, while understanding that there's just not one notion. Often dementia, we see it as embedded in the Western notion, but understanding that culture is a big piece, the spirituality is a big piece. So not negating what they have, or saying, oh, well, what you're saying is completely wrong. It's respecting their beliefs, but at the same time working towards raising that awareness piece, and the education piece is important.
Absolutely. Would anybody else like to jump in, or? Okay. Yep. Okay, moving along to Josephine Agudo, sorry, Josephine, who asks, I am interested in the activity tool that was mentioned. Is that resource available? And I believe, Sandeep, that's the one that you touched on, Navneet, as well.
So if that's the dementia kit, yes, it is. If you want, you can go on the Upna Health website that was shared, and go under the dementia webpage to order the dementia kit.
So Josephine, that's linked in the chat there. All right, and we have a question from an anonymous attendee who says, can you please provide examples of culturally sensitive activities for dementia residents living in nursing homes? We did touch on this a little bit, but if anybody would like to add to it at all.
You can, I know it's anonymous, but if they do want to reach out in an email, I'm more than happy to connect to share some of the activities that we do at the Adult Day program at Indus, if they want to collaborate and just learn some more. But I know activities, it's sometimes like painting a diya for Diwali, just doing Rangoli. So if that's a festival that's coming up, how do we get them connected culturally to that festival? Ludo, reminiscing. Understanding a lot of individuals who may come from South Asian countries may not have education or the literacy to understand activities, to do word searches. So just kind of catering and modifying those activities to their needs, and definitely connecting with the caregivers to understand their education level and what they can and cannot do.
Perfect. Great. Did anybody else want to touch on that, or?
Just want to add to that, I know music is always big across the board, doesn't matter what culture you are, but we've seen a ton of really good impact with culturally appropriate music, and just how that can trigger really positive memories for an individual, and just really getting to know them and their history and their likes and their dislikes.
Right. Navjot?
I think, again, coming back to the cultural piece, and really understanding what is culturally important to them, what kind of environment they were raised in, so they feel comfortable doing those activities. Food is another big thing. Again, it's with every culture, but even within South Asian culture, food is a big component. So I worked with a retirement home where we used to do baking with them, so it's something like that could be incorporated, where you're making tea. So chai is something that's unique to every individual. No two person make the chai the same way, and for us it's more than just the task of drinking it. It's more so like a feeling and a connection where you sit around a table with your chai and you chat and you share. So this could also be something that could be done for care partners, where a care partner support group can come together, and they can use that space to make chai and sit and share their experiences, and everything that Sandeep said, to celebrating their heritage and their community, to make them feel included.
Beautiful. Thank you all. That brings us to the end of our Q&A period. I want to thank you all so much again, all of our attendees and all of our panelists. This was fantastic. The Dementia Talks Canada team will follow up in the coming days with people who did ask questions and we weren't able to get to them. So again, please do leave your information if you'd like some answers. And thank you once again. Just so you know, the recording of this session will be posted to the Alzheimer's Society of Canada's YouTube channel in the coming days. If you registered, you'll get an email about it, so not to worry. And I know some of the questions we didn't get to did get addressed in the panel, so you'll be able to go back and take a look at those. And you can join the series next time, which you absolutely should, on December 13th at 12 Eastern for a conversation about travel and dementia. More information about that is available at alzheimer.ca/December talk. Any feedback about this event or questions can be sent to publications@alzheimer.ca. Thank you again so much for joining. Thank you to all of the ladies, and have a fabulous day, everybody.